Next on our agenda this evening is Senate Bill 102 by Senator Goodwin, an act relating to taxation, property subject to taxation, exemptions. It includes the real and tangible personal property of the Providence Community Health Centers, a Rhode Island domestic nonprofit corporation located in Providence, Rhode Island, on a list of properties exempt from taxation. This is a bill obviously from Senator Goodwin related to the property tax exemption. Senator Goodwin had another commitment this evening and was not able to join us, but we do have one witness available to speak on it, and it is Meryl Thomas with the Providence Community Health Centers. Meryl, thank you for joining and welcome to Senate Finance this evening.
Thank you, Mr. Chairman, and full committee for the opportunity to speak today in favor of Senate Bill 102. I am Meryl Thomas, the CEO of the Providence Community Health Centers. The Providence Community Health Centers have been providing health care to the citizens of Providence since 1968. We have always been a tax-exempt 501c3 organization and tax-exempt on our facilities. A few years ago, the City of Providence new staff in the assessor's office suddenly decided that we no longer fit into the language of the city charter, even though we had been for the last 50 years. Working with the mayor and city council, they have requested that PCA take the route of having state designation as a solution to our technical issues, and thus the legislation before you today. The mayor of Providence has submitted a letter of support for this bill to the committee. You should have that. The city of Providence does not have a health department or provide any direct care to city residents. Providence Community Health Centers has filled this role. We have 12 locations in the city, and we do not turn anyone away based on their income or insurance status. We currently provide health care, also with dental and behavioral health care, to 1 out of 3 Providence residents. We serve over 60,000 patients a year. Over 80% of Providence Community Health Centers patients are people of color, and PCHC has played a key role in documenting the inequities of COVID-19 infection rates in our communities, which are 10 times the general Rhode Island positive rate for the virus. Providence Community Health Centers were the first in the state to provide walk-up testing for COVID, as the previous state efforts were in the suburbs and did not meet the needs of our inner city residents. We have continued to remain open during the entire pandemic, and we continue to be open for all of our services and are providing free COVID testing, and we are now starting to provide vaccines as well. We started last week with residents over 75, and next week we'll start vaccinating patients over 65. We do not and have never received any direct funding from the City of Providence for the provision of our services. So again, as a 501c3 organization for over 50 years, PCHC is governed by a 15-member community board, 9 of which are users of the health center. We are truly a not-for-profit which uses all of our resources to provide care in our community, and our board is responsible for the constant focus on patient care and providing high-quality, accessible care, regardless of one's ability to pay or any other barrier, race, ethnicity, language, sexual orientation, or any barrier. We appreciate the hearing today and our legislation to codify what has always been in place, but now the city would like us to do it on a state level. So we do this again with the full support of the mayor and the city council. I'd be happy to answer any questions. Thank you.
Thank you so much, Meryl, for joining us this evening. Any questions or comments from members of the committee? Thank you so much for joining us.
Thank you very much.
That concludes the testimony on Senate Bill 102. I believe we're still waiting on the council resolution on this one. Is there a motion from Senator DePalma?
So moved.
Senator DePalma moves to hold Senate Bill 102, seconded by Senator Kano. Will the clerk please call the roll?
Senator Acosta.
Yes.
Senator Kano.
Yes.
Senator DePalma.
Yes.
Senator Felag.
Yes.
Senator Murray.
Yes.
Senator Paolino.
Yes.
Chairman Pearson.
Yes.
Senator Seveny. Senator Seveny, yes. Senator Sosnowski.
Yes.
9 in favor, 0 opposed.
Thank you, Mr. Clerk. We will hold Senate Bill 102.